The main research field of the Catalan Institute of Pharmacology is the pharmacoepidemiology, with a special focus on the research on the effectiveness of medicines and adverse effects in clinical practice. One of our main areas of research is blood dyscrasias and their relation with the use of drugs. In collaboration with 16 hematologic services of the metropolitan area of Barcelona, a very large database that includes more than 600 cases of blood dyscrasias have been set up, and several articles about the most frequently drugs involved in blood dyscrasias have been published. Polypharmacy to the elderly is another area of research. Recently, another area of research has been to analyze the perioperative management of patients treated with antithrombotic drugs. And fourth, our group collaborates in an international project which is coordinated by the European Medicines Agency. The aim of this project is to address the limitations of current methods and explore new methods in the field of pharmacoepidemiology and pharmacovigilance. The Gene and Cell Therapy group of our institution works at inducing immune tolerance in preclinical models of autoimmune disease using hematopoietic gene therapy. In this context, in collaboration with the neuroimmunology unit of our institution, of our hospital, they succeeded in inducing antigen-specific tolerance using transduced myeloid invasive derived suppressor cells in an animal model of multiple sclerosis. In another collaboration with the mitochondrial pathology group of our institution, they also succeeded at correcting the metabolic defect in a murine model of mitochondrial neurogastrointestinal encephalomyopathy, a very rare metabolic disease. The research activities of the epidemiology and public health research group are focused in three main areas. One of these areas is epidemiology and the prevention of healthcare acquired infections. During the last year, they have participated in the European Point Preventive Survey, an European study about the prevalence of acquired infections in the hospital in different European countries. Another area of research of this group is the new preventive vaccines. During the last years, they have been participating in several clinical trials to assess the immunogenicity and efficacy of, for example, pre-pandemic and pandemic influenza vaccines, and the immunogenicity and efficacy of human papillomavirus vaccine, among others. Finally, another area of research, they are carrying out studies on epidemiology and the prevention of some transmissible disease such as tuberculosis, chickenpox, or pertussis. The Molecular Diagnostics and Therapy group, a joint group between the Vall d'Hebron Research Institute and the Blood and Tissue Bank, is involved in the research of technological tools for the molecular diagnosis and treatment of coagulation disorders such as hemophilia and von Willebrand disease. Studies related to the molecular epidemiology and genetic analysis of these conditions constitute the basic research of this group. In this context, they are currently collaboration with the Gene and Cell Therapy of our institution in an international project using induced pluripotent stem cells as a disease model for hemophilia. Another area of research during the past years has been the application of next generation sequencing technology in different areas, such as the molecular diagnosis of von Willebrand disease. The healthcare research group of our institution has developed its research aiming to generate knowledge in the specific area of nurses' activity, and in order to implement the results in clinical practice. Part of this group is carrying out a systematic review with the objective of developing clinical practice guidelines for pain management in childhood cancer. Another part of the group is running a project about the factors related to treatment adherence in adolescents with chronic conditions such as diabetes, cancer, or cystic fibrosis. Finally, another group is evaluating the patient's quality of life who have been treated with mechanical ventilation in intensive care units during the 1 year after discharge.